So this raises the second issue: how do you do the operation? We've always done minimally invasive surgery. We believe that the minimal damage done to the hip is better for patients, because minimal damage means minimal inflammation, which means minimal swelling, which minimizes the inflammatory response and pain. And really, the only what stops patients doing well is pain and swelling. If you can eliminate those, patients will all do well. So we now have robotic technology, which we are leading in this region, which is known as Mako technology. Now, with the robotic technology, we're no longer basing the plan on an X-ray. We're now looking at a CT scan. One of the problems with conventional surgery is the position of the patient is very unpredictable. So when you lie a patient down on the table, you don't really know where the socket is. It could be there, it could be there, it could be there, it could be there. Because all the surgeon is seeing is this small window, which is surrounded by tissues. With the robotic surgery, rather than an X-ray, a CT scan is done. So it gives this image, which we're showing here, which is a three-dimensional image of the pelvis. So the surgeon will know this will be sent to America, it will be sectioned and mapped, and the surgery will be planned on your own anatomy, your bespoke anatomy. So what will come back is what will happen is that they'll be able to work out what the size of your socket is, where to place the socket, and to get the optimal position. And at the time of surgery, we'll be able to monitor where the pelvis is, so this is positioned very accurately. So sometimes the components can look positioned very accurately. For example, here, the socket looks reasonable for what you're looking, but if you turn round, you can see the position is out on that plane. So this is why the technology allows very accurate positioning. The information is fed into a robotic arm, which we control. The operation is not done automatically, and that robotic arm allows us to put the socket exactly where it should. If the surgeon tries to go too deep, higher or lower, the robotic arm will cut out. This means there's no doubt that the studies have shown, and our studies have shown, that the accuracy of the component positioning is improved. And with accurate component positioning, it has advantages in that it reduces the chances of wear, because your joint is not going to an extreme position, wearing centrally. It reduces the risk of dislocation, going into an extreme position and dislocating. And more importantly, we're now minimizing the degree of bone. Now, we have for a long time been carrying out minimal reaming. A lot of surgeons will ream the bone and they'll continue to go deep. We do the minimal reaming. We do a single ream. So we do the minimal reaming just to get the socket in. So this means less bone loss. It means less soft tissue damage, less inflammatory response, and a quicker recovery. We have found patients have had excellent results in recovery, and that's what we're recommending now for patients. Minimally invasive surgery with robotic-assisted technology, which we believe is the gold standard. And we'll talk about artificial intelligence and robotic surgery in a moment. Thank you.